Moin Hamburg! Erstmal vielen Dank für diese wunderschönen 3 Monate, wir haben hier gehabt. Wir sind aus Paris und Boston. We are Biomodex, switching to English, and we want to solve the biggest problem of interventional radiology, planning. So, today, when you undergo an interventional radiology procedure, 1 patient out of 4 will be retreated after 6 months. Why? Because planning this procedure are extremely complex. And studies have shown that 36% of these procedure errors can actually be avoided with planning. I want to share with you a story, the story of Mary. She's actually a French, pretty young, 31 years old woman. She was treated a few months ago. She has a very complex aneurysm in her brain. And the case is so complex that the professor, our doctor who had to treat her, said, "This is too complicated for me. I don't want to treat her, send her to surgery." And we started discussing with the doctor and asking him, why can you not treat her? You have the images, the 2D images, why can you treat her? And he told us this sentence that really struck us. We are people of hands. We need to touch. 2D images are not enough for me. And that's when Biomodex, we developed this solution for these physicians. We have developed a technology that can 3D print from the medical images of the patient a physical replica that has the same biomechanical properties as the actual patient. And actually, that's what I got in my hand. This unique technology is mixing millions of materials so you have the same biomechanics. I will let you touch this. This cartridge you can actually put on a station which injects blood flow in it and make it live. And then you go into the operating room. So on the left, you see the doctor, Professor More. On the operating bed, you see actually the 3D print replica, and the doctor is looking at the images while treating the patient. And now what he's gonna do is actually gonna plan the procedure and test different strategy. And you will understand how critical this is. First strategy, he tries to put a stent and actually come out that the stent is preventing the blood to go to the brain of the patient, so the patient can die. So hopefully, he doesn't do that. He said, let's try something else. And with the second strategy, you can see here, the strategy is perfect. It's working great. And so what I'm showing right now is afterwards is actually the actual image of the patient who was treated. See, it's exactly the same thing. He used the same device, the same approach, the same strategy, and the patient is now well. He presented these results and the 6 months follow-up 1 month ago in New York in front of 1,000 neuroradiologists, saying that this is where the future of healthcare has to go. We have to plan. And this is not a utopia I'm talking about. We were founded in 2015, and last year we sold more than 1,000 organs. We printed more than 1,000 organs working with the big medtech industry. Today, we sell as a training tool for the physician. And we sold 1 model, $3,500 per physician trained. And we already made 400,000 revenues. So actually, why are we here? This is a really important moment of the history of Biomodex because we want to shift from business model where we are today selling to the device industry as a training tool. And we want to make this clinical. We want to sell to the hospital. We want to be in every cath lab. And we want to sell as a patient-specific planning tool for complex cases. And for this, we have to go through regulatory milestones, having FDA Class 2 approval, CE marking. And this is already what we are doing with the first hospitals we got traction with, and we are working. Why are we doing that? Is because working with hundreds of doctors, we actually understood that Mary is not isolated cases. 20 to 30% of the patients have to be planned because it's complicated in this area. And this is also an extraordinary quote from a doctor from Berlin saying that we can actually reduce the overall cost and the time for the complex cases. These quotes, we want to prove them. And that's why we are starting studies, clinical studies, with big centers. And we are really proud to start a first study with 30 patients with the CHU de Rennes in France. And we are already discussing with leading German centers. We are starting with the intracoronary aneurysm market, which is 300,000 patients in the US. And then we want to grow to the mitral valve and all structural heart procedure, bringing us to a $5 billion market opportunity only for the US. I really want to use this particular moment to share with you our first product for structural heart procedures, which is for left atrial appendage closure. This was a big milestone because we had to invent a material that can be compatible with ultrasound that we just patented. And this is a unique milestone. I'm going to show you the first test we had with cardiologists in the US, and I just want you to hear their words.
Yeah, so that's perfect.
That ostium is beautiful.
It's very good. Yeah.
Cool. The ostium.
This is actually a very big deal for us because we worked a lot so that they say that, you know. And I am not alone. We are 30 people based in Paris, in Boston. Some are in this room. We raised more than 50 million euros because we have a very ambitious strategy. And we are ambition. We have a lot of ambition. That's why we are here in Hamburg, because we want to, of course, collaborate with Philips, because we want this technology to move a bit further, a step further, and to be in all the cath lab, and to be integrated into the clinical workflow so that every patient, everywhere in the world, can benefit about this technology, because everyone deserves a safer treatment. Wir sind Biomodex. Dankeschön.